Welcome to Radio Naturopath, the talk show about health and natural medicine. This show will first be broadcast on Wednesday, July 15th, 2026 on 91.7 FM WHUS stores. I am Fran Storch, ND, naturopathic physician. My co-host Ron Menizza is away. We're coming to you live from beautiful Mansfield Hollow, Connecticut. Comment below to let us know you're here and ask questions. You can also email me at radionaturopath@gmail.com. If you'd like to listen to the show at another time, you can check out our podcast at whus.org, iTunes, Spotify, Patreon, and Buzzsprout. You may also watch the recorded Facebook Live episode at Fran Storch ND for 30 days, and also on my YouTube channel at Radio Naturopath. The views expressed on this program do not reflect the views of the staff, management, or licensee of this station. The information presented on this show should not be construed as medical advice or direction. If you're having a medical condition, please consult with your physician. Okay, so to review some more Lyme stuff. So I'm moving along. I've been on a month of amoxicillin, and don't worry, I take lots of probiotic. I take a multi-probiotic in the middle of the day between the 2 doses of amoxicillin. And I take Saccharomyces boulardii, which is a probiotic yeast. I take that in the morning with my antibiotic because it can't be killed by the antibiotic. And digestive-wise, I'm doing very well, I must say. Everything's moving the way that it's supposed to. I'm eating lots of fruits and vegetables and nuts and seeds and chia seeds and flax seeds and hemp seeds. So everything's lots of fiber. That's all going the way it's supposed to go. And Dr. LaGuardia gave me some more amoxicillin if I wanted to continue to take it. I haven't decided how much longer I'm going to take it because I'm mostly feeling better. I do still have what I think is vestibular neuritis. Now, I don't know 100% if I have Lyme because my Lyme Western blot was completely negative, and I'm going to get a deeper dive test. That blood is going to be drawn Wednesday coming, and so after a couple of weeks, I'll have that information, and we'll see if the deep dive test finds more species or finds more antibodies or finds more, bands positive than the Western blot from the regular lab found. And if it does, if it seems to say that I still have Lyme disease, then I'll continue to take the herbs. So I'm taking a reduced level of herbs. I'm taking cordyceps. I'm going to take cordyceps for a long time, I think, because I'm very impressed with it. I think the cordyceps took away my incredible fatigue. And Lyme can make you very, very tired because Lyme goes after your mitochondria. And mitochondria, as you know, are the energy centers of all of the cells in the body. And cordyceps helps your mitochondria to function better. And it also helps to support your immune system. So it's a very nice herb to take. I'm offering it to a lot of my patients who are generally tired because I'm impressed with it. It's gentle. It doesn't seem to have side effects. And I mean, of course, anyone can react to anything, but I'm particularly impressed with this cordyceps that I'm taking. And I'm taking it in tincture form, so I'm taking 2 droppers a day, that's all. I take it in the morning because it's energizing. I don't prefer to take it at night, although some people, when they take combinations multiple times in the day, they might take the cordyceps at night, but I don't do that. And I have the motherwort, and I take the motherwort ongoing. That helps my heart to function better, helps to keep me calm, helps to keep palpitations away, and that seems to be going well. And then the only Buna herbs I'm taking right now are 10 drops a day of each, because I really had to cut back because I wasn't feeling well taking these tinctures, and I don't know if it's doing something. Hopefully it is, but 10 drops a day each of Cryptolepis, Kudzu, and Hotunia, and that's it. And that goes into a combination with like half a scoop of modified citrus pectin. So I'm taking that too. And I'm taking chlorella. I'm taking 970 milligrams of chlorella twice a day. So that's my protocol. And we'll see if how that works. The acute symptoms took a couple of weeks to go away, probably because I chose to take amoxicillin, and amoxicillin just isn't as potent as doxycycline, so it takes longer to clear stuff out. But I think it did what I wanted it to do, which was to lop the top off, if indeed I have Lyme. Again, my Western blot from the regular lab was completely negative. So we're going to find out if the Western blot or if the Lyme test that I'm going to get has anything to say, and then we'll go from there. It is possible that I had a virus, but what I am pretty sure I had was vestibular neuritis. I did not have labyrinthitis. So labyrinthitis is when it goes after the vestibular part of your brain and the vestibular part of your ear canals, your inner ear. And when you have labyrinthitis, you get vertigo. And I haven't had any vertigo at all. All I've had are balance issues. So with my ears, I had pressure in my ears, some pressure, some pain that came and went, some bouts of tinnitus, and balance issues. And I'm still dealing with the balance issues. I have balance issues anyway because of the spinal stenosis, but I think the balance issues are worse when I'm tired, and they're worse when if I eat too much sugar, and they are worse from inflammation. And so when I do things to calm inflammation and rest, the balance issues improve. I also, if I sit a lot, I get more balance issues. But again, I think that's because of the aggravation of the stenosis. And remember that Lyme, little spirochetes, those little squirrels, they go after weak spots in your body. And my spine is definitely a weak spot. So it'll go after those suffering stenotic discs in those places. So that may be part of why I have the balance issues. But I feel like the balance issues, when it was increased because of the Lyme, it was in my brain. Like I felt like my head was heavy and light at the same time. Whereas the stenosis, when it gives me balance issues, it seems to be emanating from my hips and my back. And so the whole thing is getting better. Of course, if I overdo it and I make myself really tired, then I feel extra tired. And should I be making this after working a full day? Should I be making the show right now? Maybe not. But I want to get it done, and then I'm going to have a whole weekend to have fun. So anyway, so I'm going to give you some good information now, and you should ask some questions if you want to, if you're listening. All right, so I have a few things there. Ron is off to Vermont, and he's going to have some fun up there. He's going to do a farm to fork fondo, and I didn't plan to go, so I have other things planned this weekend. I'm going to do the Erase ride. I'm very excited about it. I'm going to go to Avon, and it's a charity ride. I'm just going to do the short ride, the 27-mile ride, and see people and rest stops and things like that. And hopefully my back will hold up for that. It's only 27 miles, and it's not super hilly, so that will be enjoyable. And then I'm going to go on the boat with my friend on Sunday, so that's nice. And so I'm looking forward to a nice weekend. Anyway, so you're listening to this on Wednesday, July 15th. Boy, we're into the summer now. It's mid-July. And summer keeps going, and I hope you get out there. I hope you make sure you hydrate, and I hope you get what I wish people is hydrate, go swimming, have fun, get some sunshine, protect yourself from ticks, and stay cool. So, and I don't know that we're going to have some extreme heat waves in the next week. I think the temperature is going to go up a bit. We're going to see some mid-80s next week, so we'll see how that goes. All right. So here's some sort of fluffy stuff that we can talk about. One of them is don't put bananas in your smoothies, or at least make sure to drink your smoothie within half an hour of blending, or just have your banana 30 minutes away from your berries. And there's a reason for that. So bananas are fussy, and who knew? So this is the deal with bananas. Let me see. Oh my goodness. Well, maybe we won't talk about that because it's this smoothie mistake. I can't find it. All right, so we're not going to talk about that. Instead, we're going to talk about vitamin K2. Vitamin K2 is very important. I take vitamin K2 almost every day. I don't take it every day because, it's if you have high doses of it, it's not necessary to take it in super high doses. But anyway, vitamin K2 is a lovely supplement. So what is vitamin K2? So there was a study that showed when you took 360 micrograms of MK7, which is a form of vitamin K2. Now, mind you, that's not what I take, and that's not what I give to most of my patients. I give my patients roughly half of that. Some products have around 200 micrograms in it, but this is kind of a high dose of vitamin K2, and I don't know if you need that much vitamin K2 to do what you want it to do. But what you want it to do is you want vitamin K2 to send calcium to your bones and not make calcifications in your arteries and in your back and in your knees and all the other places you don't want it. So I take K2 to prevent my arteries from calcifying and hopefully getting the calcification out of my knees and my spine and stuff like that. I probably started too late because the calcifications were already there. So in this study, there was a study of like 180 patients, and they were at elevated risk for MI, for myocardial infarction, heart attacks, and they had baseline coronary artery calcification scores. So they did the calcium scoring test where they get the CAT scan and they see if there's calcification in their arteries. And the scores were between 50 and 400 Agatston units based on 128 slice multiple detector CT scans, that's your calcium scoring test. Compared with those on placebo, the patients who consistently took vitamin K2 showed a 29% lower calcium calcium score progression over the 2-year period based on the Agatston score, and 42% less progression in arterial calcium mass. The randomized clinical trial found that supplementation with vitamin MK7 has the potential to reduce new coronary artery calcifications in people with mild coronary disease. It's relevant because it's very inexpensive and safe and can easily be purchased. According to one of the researchers, the nutraceutical ingredient that's provided MK7, it's remarkable. They don't have any effective treatments to address the issue of vascular calcification. So when you take statins, they don't prevent you from calcification. They may prevent cholesterol from building up in your arteries, maybe, but they don't prevent calcification. But vitamin K2, that is what it does. So the overall impact of the supplementation is still modest, that it remains to be seen whether taking MK7 over an extended period reduce actual fatal and non-fatal cardiovascular events. At the outset of the study, 78% of the patients were taking statins and 67 to 74% were smokers. Thank goodness I never did that. The authors note that those points are important when assessing calcium score outcomes because statins are known to promote calcifications. Statins are known to promote calcification and raise calcium scores. Active and past smokers are also at risk of increased calcium score progression compared with never smokers. Wait a minute, I'm going to read that again. Statins are known to promote calcification and raise calcium scores. Oh my goodness. All right, many of the participants were also taking ACE inhibitors, which I am, beta blockers. So the only pharmaceutical I'm taking aside from the amoxicillin for Lyme is the ACE inhibitor. Beta blockers, calcium channel blockers, and or diuretics. Roughly 2/3 had been diagnosed with hypertension. So the men and women were randomized to 2 groups. One took once daily oral tablets containing 360 micrograms of MK7, and the other took placebo tablets similar in size, shape, and color, and the 360 microgram dose levels based on data from other human clinical studies. The researchers evaluated patients at 6, 12, and 24 months, measuring serum vitamin K status and capturing repeated CT scans to quantify calcium scores. They estimated full compliance with the MK7 intervention to be 80% over the 2-year stretch. Among those taking the supplements, plasma levels of MK7 rose from a median of 0.5 micrograms per liter at baseline to 6.56 micrograms per liter by the 2nd year, and those levels remained flat at just over 0 for those who weren't taking it. And so the attenuation progression, the MK7 supplements did not avert calcium scoring progression. The Agatston unit score rose steadily in both groups over the 2-year trial period, but the acceleration was far greater in the placebo group. So it doesn't stop you from calcifying, it arrests the progression. The rate of acceleration goes down. And so the median calcium score among the placebo-treated patients went from 145 Agatston units at baseline to 173 Agatston units, 119 to 297 after the first year, and continued rising to 214 by the close of the study. And in contrast, the Agatston unit scores among those taking MK7 were 135 AU at the outset, 150 AU after year 1, and 184. So that's a bit lower. That's a 14% difference between the 2 groups. Irrespective of what scale was used, all generalized estimating equations analyses showed that the evolution of the calcium score over time was significantly less in the active treatment group compared with the placebo group. So the yearly increase in calcium scores was reduced by 19 Agatston units among the MK7 subjects. Calcium mass scores showed the same pattern. Though the scores increased in both groups, the MK7 group showed consistently lower calcium mass measurements at years 1 and 2 compared with those on placebo. So the researchers noted that at baseline, all subjects had visible coronary plaques, but that in most cases, these caused only mild stenosis and none had life-threatening plaques. So MK7 supplementation did appear to mitigate the increase in stenosis severity over time. So stenosis is the narrowing of the arteries that make it so that blood can't get through. And so the report of 41% of patients in the placebo group showed increases in stenosis severity over the 2 years, compared with just 33 of those taking MK7. And that was not a statistically significant difference. But the observed increases in calcium scores over time did correlate significantly with increases in the number of previously non-calcified plaques that became partially calcified. The Vossen team hypothesizes that MK7 slows calcification in newly developing plaques, but has little effect on already calcified plaques. MK7 might attenuate the calcium score arose from research showing that inhibition of the vitamin K cycle by vitamin K agonists results in elevations of uncarboxylated matrix GLA protein, and this is strongly associated with arterial calcification. So one of the researchers showed that supplementation with K2 as MK7 could improve vitamin K-dependent MGP activation, which reduces arterial stiffness and increases elasticity. There's also evidence from a placebo-controlled study of 165 peri- and postmenopausal women, that the improvements in arterial elasticity following MK7's supplementation led to clinically meaningful improvements in blood pressures. That's really good. And I have blood pressure issues and I take MK7, so that's helpful. The observations from the Vossen trial support the hypothesis that MK7 can mitigate the calcium score to some degree. At both the Agatston and calcium mass score pointed in the same direction. We're confident that MK7 can slow down coronary calcium. But they also stress that the overall clinical impact of the intervention remains to be determined in future studies. MK7 is definitely promising, as well as being inexpensive, accessible, and safe, but the authors caution against overly enthusiastic interpretation of the data. But since there's no side effects, why not try it? And it does show that it has some benefit. And if you have issues with other kinds of calcification, so you have calcification in your arteries, you might have calcifications in your joints, and you might be having kidney stones too. So vitamin K2 takes calcium it helps to prevent precipitation of the calcium and helps to send the calcium back to your bones, where it can help to strengthen your bones. And we offer vitamin K2 to people who have reduced bone density, osteoporosis or osteopenia. So it can help it's one of the things you have on board when you have one of those diagnoses. And so it's easy to take. I mean, the pills are tiny because you're talking about microgram doses. It's a fat soluble vitamin, so you don't need the size of it. The size of the pill that you need to get a meaningful dose is not very big, so it's very easy to take. And usually it comes in tablets for some reason. The ones I'm taking are tablets, and they're absorbable and they're fine. So that's really exciting. So vitamin K2 in the form of MK7 can be really helpful. I have talked about MK4 in the past, which is another form of vitamin K2. And MK4 in high doses, around 45 milligrams, has been shown to prevent fractures in people with osteoporosis and osteopenia. So that's interesting too. All right, so let's talk about these after-meal gummies that help with gum disease. So this is interesting. So let's see about this. There's a gummy that delivers an army of good bacteria. So it's a probiotic gummy. And what I'm looking at here is they're in shape of gummy bears. An after-meal gummy that's packed with heat-inactivated bacteria appears to significantly reduce the prevalence of gum disease, with new research demonstrating that the simple measure could alleviate inflammation without upsetting the mouth's microbiome or requiring other oral hygiene changes. Scientists from the Institute of Science in Tokyo, in collaboration with researchers from the Tokyo Center Clinic, looked at whether a postbiotic containing heat-inactivated bacteria. So postbiotic is a product of probiotics. The probiotics make stuff, and the stuff they make that's good for you is called a postbiotic. So anaerobic gram-positive lactoplantobacillus pentosis, with a big long suffix on it, could improve gum health and reduce bleeding. They conducted a clinical trial on 116 adults who were suffering from mild gingival inflammation. Your gingiva are your gums. And the lead researcher, Takanori Iwata from Science Tokyo, explained the participants were randomly allocated to receive either the gummies containing heat-inactivated bacteria or placebo, which are non-loaded gummies. The gummies were consumed twice a day for 6 weeks, and the participants were not given any special instructions regarding toothbrushing or additional oral care, which allowed the researchers to evaluate the effectiveness of the gummies under realistic conditions. So they didn't know if these people were brushing, flossing, picking, water flossing, doing other things, using fluoride. They didn't know any of that, or using hydroxyapatite paste. Since they were in Japan, there's a likelihood that they were using hydroxyapatite paste too, because that's preferred in Japan. I don't even know if they use fluoride in Japan. They use hydroxyapatite. After the 6 weeks, the team assessed the participants' gum health and gingival index, which is a common measure of gum inflammation, and those who consumed postbiotic gummies experienced reduced gum bleeding and appeared to have stronger gums overall compared with the placebo cohort. While there was no meaningful difference between the two groups in the gingival index, those eating the active gummies had a much better score at the end of the 6 weeks than at baseline. According to the World Health Organization, severe periodontal disease affects about 1 billion people across the globe. So that's a decent amount of people. In the early stages, it prevents gingivitis with symptoms like swollen gums that are prone to bleeding, and good oral hygiene remains the best form of prevention. But scientists are looking for novel, user-friendly ways to support gum health. Because face it, I'm looking at you. Did you floss last night? When I talk to my patients, they don't necessarily make it to flossing every night. They might brush their teeth, and people will fall asleep before they brush their teeth at night. And some people are lucky enough to have a good microbiome that protects them and they don't get extra cavities. I am not that person at this point in my life. I have to do everything. And it's amazing what my tooth regimen is at night. It's extensive. But one of the things I do, I'm not taking a probiotic gummy. I am taking a probiotic lozenge that I can get, that you can readily get a special probiotic that you can suck on or chew. That is for, the probiotics are specifically to protect your teeth. So that I'm using one of those, and I put it in after I brush, floss, pick, water floss, rinse, fluoride, and hydroxyapatite. And then the last thing I do when I lay down to go to bed, before I go to sleep, I put in the probiotic gummy and I suck on it and then I go to sleep. So if you harness the power of beneficial bacteria in shelf-stable probiotic, the nice thing about a shelf-stable probiotic is you can put it on the nightstand. And the thing is, it's nice to get that probiotic in when you go to bed if you can, because you're going to spend the night with that good probiotic in, and you're not going to have the chance for stuff to grow excessively overnight. So they're also recommending taking it right after you eat, which is another way to do it. But I think it's going to be more effective. If you do both, that's great. But it's going to be more effective if you use it before you go to bed. If you clean out your mouth before you go to bed, you don't have whatever you ate during the day sitting on your teeth for hours and hours and hours without you eating or drinking and washing stuff away. So that brushing your teeth and getting your teeth clean before you go to bed is really important. I admit that I don't always make it. If you're really tired, sometimes you just can't get yourself up to get to the bathroom and get your teeth done. But I'm trying. I'm working on it. So heat inactivated bacteria are nice because you can take a bottle of those and put it on your nightstand. So you don't have to go get it out of the fridge. And I have patients who, if they have a supplement that has to be in the fridge, they're less likely to take it because they have to go to the fridge to get it. They can't keep it all in one spot. Most supplements you don't have to keep in the fridge. But if you have a shelf-stable, heat-stable probiotic, then you can keep it with the rest of your supplements, or you can keep it on your nightstand, so you can do it. You can take it the last thing before you go to sleep. And if it's one of those nights where you just didn't make it to the bathroom to brush your teeth, you can still pop one of those probiotics and it'll do something for you. So in the study, the researchers believe that the reduction in gum bleeding could be due to the anti-inflammatory properties of the postbiotic gummies. And reducing inflammation at this early stage of gingivitis could prevent the condition from progressing to more severe periodontal disease. By evaluating the gummies under normal daily living conditions, they were able to better understand their potential for supporting gum health. Next, the researchers will turn their attention to better understanding the underlying biological mechanisms at play and assessing the potential long-term benefits of postbiotic gummies and oral health. So did you know there's a journal of periodontology? So you could look at this study in that journal. So who knew? Oral health is super important. If you have excessive, it can cause all kinds of things. Those bacteria can travel into your blood and give you cardiovascular disease, and they can travel into your blood and make you septic. So keeping your teeth clean is super important. So those are that's the probiotic gummies. And here, let's have a look at what probiotics are good for oral health. So there's a growing trend of holistic health that's transformed how we approach wellness, and oral health is no exception. Probiotics, which are thought of mostly for gut health, are now a powerful ally in maintaining a healthy smile for your mouth. More and more people are discovering the benefits of oral probiotics as a natural solution to improve dental hygiene, balance oral bacteria, and combat common oral health problems like bad breath, cavities, and gum disease. So you want to choose the right oral probiotic strain. And so oral probiotics are a specific type of probiotic that target the mouth's microbiome. That's the bacteria that live in your mouth. The balance of good and bacteria within the oral cavity, unlike the probiotics that you find in yogurt or supplements designed for gut health, oral probiotics are tailored to support your mouth's unique bacterial environment. These probiotics help to balance the oral flora, reducing the growth of harmful bacteria that can contribute to common dental problems. When harmful bacteria grow, it can lead to issues such as gum disease, cavities, and even bad breath. Oral probiotics work by encouraging the growth of beneficial bacteria that keep the oral environment balanced. So Lactobacillus reuteri and Streptococcus salivarius are strains that are found in probiotic products and have been shown to support gum health, freshen breath, and reduce plaque buildup. Scientific studies support the use of probiotics in herbal care. Research has demonstrated that the right strains can effectively reduce gum inflammation, improve oral hygiene, and even help prevent the development of cavities. With increasing evidence pointing to their effectiveness, oral probiotics are quickly becoming a must-have for anyone looking for a holistic approach to oral health. So you want to consider what strain you're getting. Different strains of probiotics serve different purposes. For oral health, you want strains that are specifically beneficial for your mouth, like Lactobacillus reuteri and Streptococcus salivarius. Lactobacillus reuteri helps combat gum disease, whereas Strep salivarius is known for helping your breath stay fresh. You want to know how many colony-forming units, or CFUs, are in your probiotic. So you want something with sufficient CFUs. A product with 1 or 2 billion CFUs per dose is considered effective. And you want your probiotics to be research-backed. Not all of them have been tested for oral health benefits. Make sure the product has evidence or studies supporting the effectiveness in reducing gum disease, plaque, or bad breath. And oral probiotics come in various forms: lozenges, powders, and tablets. Choose one that fits easily into your daily routine and has a pleasant taste. Usually they're minty flavored. You're going to taste a little bit of that sour taste of probiotic when you're doing a lozenge or a chewable. But, a lot of times they put mint in it, and the one I have is mint flavored. Sometimes they're other flavors. Sometimes they're fruit flavors. So there's a holistic dentist in Illinois who recommends incorporating probiotics into your oral care routine for a whole body dentistry approach. They're a natural and effective addition to your top care routine. So there's various brands. There's a bunch of brands out there. So you just look for the ones that have the good probiotics in it. So one brand has Streptococcus oralis, Streptococcus uberis, and Lactobacillus reuteri. And this one is a comprehensive probiotic that freshens your breath, reduces plaque, and supports your gum health. Then there's another one that is mostly reuteri and acidophilus. And it's designed to support gum health and freshen breath and reduce inflammation. And then there's another one that just has Strep salivarius K12, and I have ones that have that as well. It's studied for the ability to reduce bad breath and promote fresh breath by neutralizing VSCs, volatile sulfur compounds. And so when you have that sort of swampy smell taste in your mouth, Strep salivarius can fight against that. And then there's other probiotics that have Lactobacillus reuteri and bifidobacterium. So that's also for gut health and the microbiome. I have probiotics that I've given to people that weren't necessarily for oral health. They were just a chewable probiotic. And I had one that was orange flavor, it was very nice. And I would give it to kids that mom would come in and say she has bad breath and her oral hygiene isn't the best. So I would have them suck on this probiotic and it improved, even though it wasn't necessarily I don't know that it had these strains in it, but if you suck on a probiotic in your mouth, I think it's still helpful. And this is saying that yogurt doesn't have the right strains in it. What I also recommend that people consume kefir. And I just wonder if you consume kefir, kefir has a lot of strains in it. I don't know if it has the perfect strains for oral health, but if you sip kefir and you swish it in your mouth before swallowing it, you might get some benefit from your oral probiotics. So that's another thing you can do instead of having a lozenge. If you like kefir, what I'd recommend is getting plain kefir, nothing sweet in it, no fruit, no nothing, just plain kefir. It is pretty sour, and if you enjoy that flavor, you can sip on it slowly as the last thing before bed. It's going to have some tryptophan in it, so it's going to help you sleep. And then it's going to have all these great probiotics in it. So you swish it in your mouth and then you swallow it. And then it's going to help your mouth and your gut. So it's very nice. I have Ron doing kefir because he can tolerate dairy. I can tolerate a bit of dairy, but not an everyday thing. But I encourage him to do kefir every day because he's got all those funky gut issues. So, yeah, so oral probiotics, huh? All right. So now let's talk about how surgery it's possible that surgery can worsen knee pain. Who knew? So there's a bunch of things you can do instead of surgery. So when you have knee pain, there's a lot of things that you can do, and you have to get your knee pain diagnosed. So, when people have knee pain and they don't know what's going on, and just basic stuff like physical therapy and icing and resting aren't quite working, it's a good idea to go get an x-ray to start to see what's going on in there, and then make decisions about how you want to proceed. But whatever's going on in your knee, rice is helpful. Resting it from whatever you were doing and not moving it excessively. But you don't want to only rest it. If you're in acute inflammation and pain, then you want to definitely rest it. But if you're not in acute inflammation, you want to keep your knee moving, because I have arthritis in my knees, and my right knee is in worse shape than my left knee, and I think it's because even though they both have a lack of cartilage, the right knee has some floating calcifications in it, so that knee kind of feels thick. But since I've had the PRP shot and have been taking glucosamine, I've been able to function. I've been able to walk. I haven't been able to run. I haven't tried running or jumping or dancing, but I'm able to walk. By walking, I mean go for walks of a couple of miles, and I'm able to get on my bike, and I've ridden 30 miles and been fine. I do brace my knee, and I remember last year before I had the PRP shot and was taking glucosamine, I would do a ride like that, and my knee would suffer a lot more than it does now. So I think the PRP helped, and I'm thinking I'm going to get another PRP shot because Dr. Moss said I could do that, because it is feeling kind of thick, and I've been using it a lot because I've been riding my bike a lot. But I do rest it, and I do ice it at the end of the day. Not every day, but I do ice it. I do have a red light therapy knee wrap that I will use sometimes. That's something you can do as well. You can get red light therapy devices online. And then riding a bike is a good thing for your knee. If you ride it at a level that isn't painful, and I have to watch climbing, because climbing is the thing that will make it hurt more. Just spinning tends to make it seems to be fine. The less climbing I do, the better it is, but I am able to climb. I don't climb very fast, but I am able to climb. And the stronger you get, the easier it is to climb, so you can keep it going. Spending time in water, any kind of water. If you can go in the bath, if you go in the bath with Epsom salts, that's good. If you can go into natural bodies of water, if what you have near you is a lake, I go to Bicentennial Pond, I'll get in the lake there, and that's helpful. I went in the Sound, and the Sound was not as salty as the Gulf. And the Gulf really feels like the ocean, but the Sound is not so salty, but it's still helpful. And then, of course, going in the ocean is a good thing. The combination of being in the salt water and moving around, and, when you get to jump waves or go swimming, that movement helps your knees, and it helps all of your joints. So spending time in natural bodies of water is good. If you have to spend time in chlorinated water, then do that, because it can help too. And then you can get rubs that have menthol in them. So menthol is, it's in wintergreen. It's mostly in mints It's an extract of mint, and it makes your knee feel cold when you put peppermint on, or, the extract of mint, which is menthol. It feels hot and cold at the same time. And I find those useful. And then you can also put things with DMSO on your knees, especially if you have osteoarthritis. I think that's helpful too. So you can get these combinations. You can get straight up DMSO. If you put DMSO directly on your knees, you're going to taste onions and garlic in your mouth, because there's sulfur compounds that go into your blood, and they make you taste that. But you can get DMSO salves that are mixed with other things, so that doesn't happen. And I have a DMSO lotion that has DMSO and has magnesium and has arnica and aloe, and it's very nice, and it smells like it has rose scent in it, and like that's natural rose scent. It's lovely. So that's what I use. And Dr. LaGuardia said it was okay. So he's a big fan of the DMSO. I do have regular DMSO, but you have to dilute it, and I just haven't done it. And you can do acupuncture for sure. And you can do acupuncture, get needles, and depending on what your tolerance is. I had my acupuncturist, she put needles in my knee, and we couldn't do that. She has to do points that are remote to the knee in order for me to get relief. Chiropractic is good too. My chiropractor adjusts my knees. He doesn't jerk them or anything, but he does adjust everything around them, and he will use his gun to put the patella back in place, and probably to push the calcifications out of the way, because I have one sitting in the front and one sitting in the back. And then, of course, knee strengthening PT exercises. So you do what you can tolerate. And very simply, you can do wall leg lifts, where you do basically an isometric lift, where you hold your leg straight and lift it up and hold it for a few seconds and drop it. And then you can sit on the side of a chair or your bed and just do flexing exercises, flexing and extension of your knee. And then there's wall sits. So, as long as my knee's not hurting too much, I can do wall sits. So you lean against the wall, and you lower yourself so that your knees are as close to 90 degrees as you can get them. If you can't get your legs to 90 degrees, get as low as you can comfortably get. Something is better than nothing, and that's helpful too. That'll strengthen the muscles, your quads and your calves and the ligaments and tendons around your knees. It's going to help with that. And also wall ball squats. So you have a ball behind you. You can get one of those smaller bushy balls, like the ones that you play dodgeball with, or one of those toy balls that are, swirls of color. Or you can get a great big exercise ball, and you put it against the wall. You put your back against the ball, and then you squat. And those I do 2 seconds, eight reps of 2 seconds, and do a few sets of that. And all of those things can help. And the other thing is, let me see if this is talked about here. I don't think it's talked about here, that you can do sham surgery on knees. And the sham surgery isn't really sham, but you can do arthroscopy, where you just clean the knee out. You lavage it with saline, so you get the inflammatory compounds out of it. And then if there's any calcifications that are floating around, like I have floating calcifications in my knee, you can get those out, because those tend to get stuck, and they'll press on structures, and they'll cause pain and inflammation. So you can get arthroscopy. The thing is, arthroscopy, anytime you start in with surgery, the knee is very delicate. So you're dealing with pain, and you're dealing with recovery time. So if you can do it without getting surgery, that's a good thing. However, if your quality of life is badly affected, it may be worth it to get surgery. So, but, try everything that's not surgery first. And that's what I'm working on right now. I'm trying to keep myself out of knee surgery. I haven't had any knee surgery. I had the back surgery. I'm concerned about that, and I don't know if I'm going to need more back surgery at some point. I'm hoping not. But, that having orthopedic stuff as you get older, your doctor tells you have to lose weight, and then it's hard for you to get exercise because you have orthopedic stuff. So it's hard to lose weight, and you have to really starve yourself in order to lose weight. And then there are some people who they deny them surgery because they're too heavy, and they have to lose weight before they'll give them surgery. Which, how do you do that if you're compromised? It's true that weight loss is 70% in the kitchen, but it is 30% exercise, and exercise will help weight loss happen faster, and it'll help your Now, it doesn't only help you, it doesn't only help you lose weight, it also helps your mood and helps you feel better about your body. And you do build muscle mass and strength, and you're just generally happier when you get exercise. So it's easier to feel good about yourself and therefore eat healthfully if you're able to get exercise. And if you're prevented from doing that because your doc says, nope, you can't have the surgery because you're too heavy, that's just devastating. That's just so hard. And thankfully nobody said that to me, but I know, I have weight that I could lose, and I just wonder if I did focus on that, how much of my orthopedics would improve. So we're working on it. We're going to see what happens there. All right, so there's that. So we're going to go back to talking about swimming because it's that time of year. Swimming in natural waters is good for you. And here's 5 reasons to swim in natural waters. So contact with natural water stimulates and boosts your immune system. So the woman, Natasha Campbell McBride, who wrote the GAPS protocol, she tells people who do the GAPS diet, this is the gut and psychology syndrome diet, people should swim in natural waters of lakes, rivers, and the sea instead of toxic chemical soup of swimming pools. Natural waters are full of life, biological energy from plants, and different creatures, minerals, enzymes. Don't forget the negative ions, and many other beneficial substances. Swimming in natural waters has been prized as a therapy for many health problems for centuries. Obviously, you have to make sure the water you swim is as far from possible from industrial pollution. It's a great immunity booster. And there has been research showing that regular immersion in cold water is a mild stressor and immune stimulant, which increases your white blood cell count, which is an important part of your immune system. So ocean swimming therapy was always around since the time of the Romans and Hippocrates. It's used for medicinal purposes, and it's called thalassotherapy. Seawater is full of minerals, amino acids, trace minerals, and has a composition that is much the same as our blood plasma. So I know that when I get in the ocean, like when I went to my mother's and I got in the Gulf almost every day, I felt so much better. Like my back felt better, my knees felt better, my friend felt better. And I hadn't even treated myself for Lyme disease yet, so I'm looking forward to going back in the Gulf in September. So when you swim in natural waters, it triggers the release of endorphins. Those are those chemicals that give you that happy, satisfied feeling of well-being. The mental benefits of swimming are outlined in Swimmer magazine. Regardless of the cause, a growing number of researchers and psychologists have become true believers in the efficacy of swimming. Vigorous exercise like swimming can significantly decrease both anxiety and depression. And currently there's a ton of research looking at various mechanisms by which it works. On the physiological level, hard swimming workouts release endorphins, natural feel-good compounds whose very name comes from endogenous morphine. Swimming serves as well to sop up excess fight-or-flight stress hormones, converting free-floating angst into muscle relaxation, and can even promote hippocampal neurogenesis, the growth of new brain cells in the part of the brain that atrophies under chronic stress. In animal models, exercise has shown itself to be even more potent than drugs like Prozac at spurring such beneficial trains. Moby Kokillard, who's a psychotherapist and swimmer from California, is so convinced that he prescribes exercise to depressed patients. I tell everybody to get exercise. Basically you need to exercise for your life and for your health. Whatever exercise, the best exercise for you, of course, is the one you'll do. Anyway, so he believes that swimming can serve as a kind of medicine and represents a potent adjunct to antidepressant medications, and it's something you can do instead of taking pills. Not for everybody, but it's certainly something you should have in your repertoire. Natural water swimming jumpstarts blood circulation. When you flush, move, and cleanse the skin, and you go back to the inner organs, you can enhance the process by taking a sauna and then jumping into cold water. So people say they feel great after a sea or river swim, which may be just because the chilly water activates cold sensors over the body, which are cells that are positioned just 0.18 millimeters under the skin, which increases heart rate and gives us that alive feeling. Michael Tipton, who's from Portsmouth University, said that. The cold centers trigger a sudden burst of adrenaline, epinephrine, that diverts our attention away from our aches and pains, creating that feel-good factor and is a natural painkiller. When we put our whole bodies in cold water, the blood moves quickly away from our extremities, going to major organs, and then back again to skin and extremities as we warm up. Natural waters are essential to a healthy outdoor life. There's a book called Adopted by Indians. That was the true life account of a pioneer boy raised in the peaceful, happy life of the Choin Indians of California's Central Valley, and how they lived their lives before the land was taken away. Part of the everyday, mostly outdoor routine was an early morning bath in the river. Young and old bathed before sunrise and dried off by the fire. No towels, no laundry. And it's good to be outside, of course, as much as possible. Natural waters are a great way to play. So play is good for kids. It's good for grown-ups too. An adult who has lost what was a playful childhood and doesn't play well will demonstrate social, emotional, and cognitive narrowing, be less able to handle stress, and often experience depression. Play is the gateway to vitality. The prevalence of depression, stress-related diseases, interpersonal violence, addictions, and other health and well-being problems can be linked like a deficiency disease to the prolonged deprivation of play. According to the National Institute of Play, play generates optimism, seeks out novelty, makes perseverance fun, leads to mastery, gives the immune system a bounce, fosters empathy, and promotes a sense of belonging and community. Nothing lights up the brain like play, and playfulness gives you a leg up on adaptability as a species. Water brings out the play in us. We float, we dive, we see if we can stick our legs in the air, we splash each other. So find yourself a swimming hole wherever you can go. In this area, so I live in Mansfield, and you are not supposed to swim in Mansfield Hollow. You see people going in there sometimes. You're really not supposed to do that because it is a water source, and yet people will go in, they'll get in their kayaks and they'll fall out. You're really not supposed to do that. But there are lakes that you can swim in. In Mansfield, in the town of Mansfield, we have Bicentennial Pond. That's a place you can go. They have Day Pond Park in Colchester. There's Bigelow Hollow State Park in Union, which is a lovely park. And all the state parks, by the way, there's no charge there's no charge for parking. And then there's Hopeville Pond, which is very nice. I believe it's on the Chautauqua River. Anyway, it's a beach down in Hopeville Pond, down in the Patchogue Forest. So that's a place you can go. And if there's more lakes that you know about that are generally, and then of course there are town lakes that you have to live in the town to be able to go to, like Columbia Lake and Coventry Lake and Amston Lake and Andover Lake. I've been in Andover Lake because I had a friend who had access to somebody's house that lived there, and you're able to go in the lake. So you have this private lake situation, unfortunately. And then you have the state parks, and those are places you can go in. And then people find wide places in the rivers, and they do go in there. Like people go under the bridge on Atwoodville Road here, and that is the Natchog River. So there's a few places like that around that people know, oh, you can go under the bridge and you can hang out there. So anyway, finding natural waters to swim in is a great idea. And then, of course, remember that all the state parks along the Sound are no charge, and you can go and park there if you're a Connecticut resident. So, I find the Sound, it's not as briny as the ocean, but it's a little briny, and it's a nice place to get in. One of the things I found about the Sound too is it's cold. I went in on July 1st, and it was freezing. I mean, it was somewhere in the 60s or 70, which is good for your immune system. It was a very hot day, but I definitely felt better going in the water. Yeah, getting in, finding places to go swimming naturally is really good for you, and I recommend it. Okay, now here's specifically why swimming in the ocean is good for you. Let's see. So this is specifically about swimming in the ocean. The ocean gives you stress reduction. So the ocean's ability to alleviate stress is unparalleled. The sounds of waves crashing, the rhythmic ebb and flow, the expansive horizon. It's a naturally calming environment. The serene setting helps lower cortisol levels, which is your stress hormone, which promotes a sense of relaxation and peace, and that time spent by the ocean can significantly reduce symptoms of stress and anxiety. So the blue space effect, as it's often called, refers to calming impact that the sight and sound of water have in our psychological state. And I definitely experienced that. I love to look at water, even if it's just a brook. I went on a bike ride, and they're building a bridge on Old Colchester Road, and there's a brook that goes by under Old Colchester Road. And I just stood there and watched it for a while. There's a little footbridge where they're building the bridge on the road, but there's a little footbridge across the creek there. So the natural stress relief is crucial in the fast-paced, often chaotic modern life, which offers a respite and chance to decompress. And when you walk along the beach, swim, or simply sit and watch the waves, it can be incredibly therapeutic. The other thing about sitting at the ocean or in the ocean, one of the things about looking at screens or looking at print is that you're having to focus narrowly. When you focus narrowly, that increases your cortisol. And it can make you dizzy too. If you have problems with headaches and dizziness, when you have to focus on a screen, it's stressful. It increases stress. And every time you look at that screen, whether it's your phone, tablet, or the computer, it increases your stress. When you are able to allow your eyes to visualize panoramically, and that is looking at a vista that's a long way away, that's so much better for you. You don't have to focus narrowly on one thing. So your body is allowed to do that when it's in nature in general, and particularly when you're at the ocean. So the ocean gives you mental health and clarity. It's a profound effect on mental health. The repetitive sounds of the waves and wind contribute to a meditative state which promotes mental clarity and emotional balance. That setting is particularly effective in reducing symptoms of anxiety and depression, which offers a peaceful space for mental rejuvenation. The visual stimulus combined with the physical act of swimming or floating in the water can lead to increased mindfulness and a reduction in negative thought patterns. Activities like snorkeling, surfing, or even a simple boat ride allow for a mental break, providing a unique form of therapy only the water can provide. And these health benefits are what the popular float tank businesses replicate by providing the pods of high salinity water that make floating effortless. So you get a mini ocean inside of a building. So you could do, if you can't get to the ocean, you can go to the float tank. And we have there's a float place in Willimantic. There's another one in Brooklyn, Connecticut. So there's heart health benefits of ocean swimming. When you swim in the ocean, it's not just a leisure activity. It's a comprehensive workout that benefits your heart and the entire cardiovascular system. The act of swimming involves almost every muscle group in the body, which provides a full body workout that improves heart health, enhances circulation, and builds endurance. Water resistance is about 44 times greater than the air, so ocean swimming is an efficient way to strengthen your heart and lungs. This form of exercise is also low impact, meaning it's gentle on the joints and suitable for all ages and fitness levels. Regular ocean swimming can lead to improved cardiovascular health, reduced risk of chronic disease, and enhanced overall physical fitness. The natural surroundings of the ocean add an additional benefit, as the serene environment can help lower blood pressure and promote relaxation, which further supports cardiovascular health. Whether a gentle swim or rigorous ocean workout or just freaking jump in the waves, it can help you feel smooth and refreshed, and help and give you lots of cardiovascular heart benefits. So ocean is your natural spa for your skin health. There's lots of natural minerals like magnesium, calcium, and potassium, which are beneficial for your skin. It can act like a natural spa, which revitalizes you from top to toe. The minerals help cleanse and detoxify the skin, promoting a healthy glow. Salt water has natural antibacterial properties that make it effective treating skin conditions such as eczema, psoriasis, and acne, and also fungal infections. I tell people with foot fungus to go to the beach, go live at the beach, go stay at the beach, go walk on the beach, walk barefoot on the beach. You can exfoliate with the sand, and you can also just get in the water. And fungus doesn't do well in lovely salt water. So the gentle exfoliation of the sand and salt helps to remove dead skin cells, leaving you feel smooth and refreshed. Regular exposure to salt water can improve your skin's hydration and elasticity, which reduces the appearance of fine line and wrinkles. And working together to nourish and heal your skin, the ocean is a ideal natural wonder for those looking to reap the benefits of its spa-like features. When I came home from Florida, I bought Dead Sea salt lotion. I haven't been using it every day, but I used it last night. It's very nice. Your respiratory health will be improved by being at the ocean. When you breathe in the fresh, salty air, you're going to get those negative ions, which are known to improve lung function and increase oxygen absorption. The ions can help clear the airways, reduce symptoms of asthma and allergies, and promote easier breathing. And the humidity in the ocean air can also help to keep the respiratory tract moist, which is beneficial for those with respiratory issues. When you inhale the sea breeze, it can help cleanse your lungs, expel toxins, improve overall respiratory health. For those with chronic respiratory conditions, spending time by the ocean can be a natural way to alleviate symptoms and enhance your lung function. And then you get vitamin D when you're outside. When you spend time in the ocean, it's an excellent way to get some much needed vitamin D. When you're out in the sun, your skin synthesizes vitamin D, which you need for your bone health, immune function, and mood regulation. Adequate vitamin Ds are linked to a reduced risk of osteoporosis, heart disease, and certain types of cancer. When you spend time in the sun by the ocean, it allows your body to naturally produce vitamin D, which can be difficult to obtain from food sources alone or from the environment, especially in the darker times of year. And you still want to use your reef-safe sunscreen so you get the good and none of the harmful UV rays. And you will sleep better if you go to the ocean. There's a reason why so many white noise machines have a wave setting. The consistent sounds of the waves act as a natural calming mechanism that can lead to deeper and more restful sleep. The physical activities associated with the ocean, like swimming, walking along the shore, surfing, and snorkeling, can also contribute to better sleep by reducing stress and increasing physical tiredness. With so many pieces of our health linked to sleep, from our immune systems to our mental health, ensuring we get enough is vital to our overall well-being. If you're visiting Oahu or some other place at the beach, you can enjoy a peaceful nap on the beach, or if your vacation rental is close to the shore, you can use the ocean as a wonderful backdrop to your relaxation. So the ocean offers a multitude of health benefits that can enhance your physical and mental well-being. From stress reduction to improved cardiovascular health, the healing power of the ocean is undeniable. So find a place that you can go to the ocean or even the Sound and go there and hang out, and you'll probably feel so much better. So hopefully some of you listening to this this is going to inspire you to go to the beach sooner rather than later. I'm going to go in the Connecticut River on Sunday. So, and the Connecticut River, especially the south part, is brackish because, it mixes with the ocean at the bottom. So I'm looking forward to that. All right. So I think that's enough for today. That was a lot of stuff. So thank you for listening. You have been listening to Radio Naturopath, the talk show about health and natural medicine. I am Fran Storch, ND, naturopathic physician. You can email me with questions and comments at radionaturopath@gmail.com. If you'd like to listen to this show at another time, you can check out our podcast at whus.org, iTunes, Spotify, Patreon, Buzzsprout, and YouTube. You may also watch the recorded Facebook Live episode at Fran Storch, ND. The views expressed on this program do not reflect the views of the staff, management, or licensee of the station. The information presented on this show should not be construed as medical advice or direction. If you're having a medical condition, please consult with your physician. Thank you for listening to Radio Naturopath, your show where you can learn about the best of science and nature. We'll be back with more Radio Naturopath next week at 91.7 FM, WHUS stores, and WHUS.org. Thanks for listening.